Hello, my name is Monica Jackson with Seasons Hospice. I'm the clinical nurse liaison. I just wanted to talk to you guys about hospice in general and our objectives of how to refer someone possibly to hospice if they need it. So our objectives for today are: what is hospice and the services it provides? Who qualifies for hospice? What are signs that a client may need hospice? And who do you call if a client needs hospice, or what do you do essentially? So this first objective is, what is hospice? So hospice is just a continuation of care, just so, like home health agencies and caregiving agencies provide that extra support. Some individuals need hospice as well. Hospice can provide care in all settings. That means we can come to their home, assisted living, skilled nursing facility, wherever they are, wherever home is, hospice can come. The services and clinicians that hospice provides are a registered nurse, social worker, chaplain, medical doctor, and hospice aide. Typically, between all of these disciplines, there are about 3 to 4 visits a week, more if need be, but that's all dependent on the assessment from the RN case manager, as well as other disciplines that set their own kind of visit frequencies essentially. But an aide can be scheduled at the same time as the assigned caregiver to make it easier perhaps, or they can supplement on different days to do hygiene needs or bathing needs on 1 or 2 days out of the week that the assigned caregiver is not there with the client. Hospice also provides any medical equipment needed for the client and their family that's related to their hospice diagnosis or decline. This is including but not limited to hospital bed, bedside table, bedside commode, Hoyer lift, wheelchair, oxygen, whatever helps with their physical and mental state during this period that they probably will decline more, as far as being weaker or forgetful. Sometimes people need bed alarms or even chair alarms, which hospice can provide as well. So essentially, the client gets a whole team as well as the medical equipment that they need to provide care. So we can teach on just their diagnosis in general of what we expect to happen, as well as educate on the medical equipment provided, such as the Hoyer lift or the hospital bed, just to make sure that the family's comfortable, the client's comfortable, as well as the caregiver assigned to that client is comfortable as well. So it's not just caring for that client, but also helps for perhaps more difficult clients that need that extra support, and we can support the family as well as the caregivers, the team already in with that client. So also, hospice is usually minimal to no cost to the client and family, is usually covered under their health insurance or their Medicare benefit. So moving on to the next objective is, who qualifies? So the qualification is the client has to be determined by 2 medical physicians of having a life expectancy of 6 months or less. That means the doctors would not be surprised if a client dies in the next 6 months. This is just based on their overall how they were. So Mrs. Jones was walking and talking 5-6 months ago, and now she's wheelchair in bed or bedbound, talking less, and we get that picture of, hey, they were like this before and now they're like this, which we'll go in more detail in a bit. Some individuals or clients live longer than 6 months. It's just that the physicians have to have a reasonable medical assumption given the diagnosis and given the decline. Mrs. Jones was this and now she's like this and she has Alzheimer's disease, that they can make the assumption that they wouldn't be surprised if that individual or client does decline further as well in that 6 months. So that's who qualifies. The next objective, and which will be a little bit longer, is what are the signs that a client may need hospice? And so I'll go through each kind of point, as well as elaborate and give more details on each point. So the first point, as far as the signs a client may need hospice, is frequent hospitalizations, especially if it's in a short period of time. Like Mrs. Jones went to the hospital 3 times in the last 4 months because she keeps on falling. Or Mr. Jones went to the hospital because he has trouble breathing, especially when he's trying to go from his chair to his bed or something like that. So frequent hospitalizations, especially in a short period of time, those individuals may need hospice. And then there's functional decline. So these have a lot of different details in it, and I kind of went through it as activities of daily living. There's 6 of them. So the first one is ambulation. So a client was walking before, very, with it and steady, and now they're walking shorter distances perhaps, or walking unsteady. Frequent falls, needing more people to assist. So Mrs. Jones had one person or yourself, a caregiver assigned, and then now you're needing extra help or extra hands or more equipment to actually get Mrs. Jones to move from her chair to her shower or something like that. Also now only being able to transfer, becoming bedbound, increased stiffness, increased weakness. All those are signs that somebody is becoming more weak, perhaps, and they could possibly need our help. The next point is eating, not being able to feed themselves anymore. So she was able to eat a sandwich on her own, and now she needs more encouragement, or the caregiver actually, or yourself needs to feed them now. Taking longer to eat. So they could eat a whole meal in 15 minutes, and now it's taking them 30, 45 minutes. Eating less food, so they're not eating as much. Now they used to eat a whole sandwich, and now they're eating only half of a sandwich or a quarter of a half of a sandwich. Pocketing and or not eating their food, not swallowing their food. So they'll put something in their mouth and they'll kind of cheek it into their mouth and won't swallow, and you have to get it out their mouth. Also coughing with food, so what we call aspirations. So they're usually pocketing and coughing kind of go hand in hand, being difficult to swallow food. So those two are major signs, like, hey, they again may need more help or more teaching on how to do those things. The next point is dressing. They have been able to dress themselves before, or able to help dress, or able to turn, or stuff like that, and now they cannot. That's also a sign of decline. Bathing, being able to assist again with their showering or their hygiene needs, and now they're gradually being able to less engage and help with showering and bathing. And overall, if their hygiene, when you come in and they're now soaked and stuff like that, that goes hand in hand with toileting. So they used to be able to use the toilet or commode, and now they're using diapers or briefs more frequently. All those items can show a sign that, hey, they're getting weaker, they're being more incontinent, they need that actual higher level of support. The next one is memory / mental. So able to remember tasks. They were doing those things before, able to follow simple commands. Hey, can you put your feet down off the bed? Or can you step this way? And it doesn't really click in their mind. Those are all signs to look out for. Forgetting family members, perhaps even being combative with care, or just overall helping them out. Needing more redirection. Sleeping more throughout the day. So that's a big one too. They were able to talk and engage more, and now they're napping through your visit. Difficult to awaken, talking less, so verbalizing less. They were engaged and able to have a whole conversation, and now they're saying how, what, or not talking at all. So all those are major functional decline. So the ambulation, they were walking and now unsteady, frequent falls, needing more assistance. They were eating, now they need help eating, pocketing food, or not eating, or eating less. Dressing, toileting, bathing, all those stuff they could help with, or it was less difficult and now it's getting more difficult. And memory, needing more redirection, cues, monitoring, stuff like that, are all under that functional decline. The next major point is skin breakdown. So I'll go through these last 3 points under signs of who may be appropriate for hospice or needing hospice kind of more quickly. So skin breakdown, openings to the bottom relate to pressure. So client who usually sits in their chair most of the day or in their bed or in one place, they're more prone to have skin breakdown. So they're sitting all day and now they have an opening maybe to their bottom, or some other area where they were sitting. Other skin breakdowns could be skin tears or injuries due to falling, bruises, cuts, scrapes, and then also weeping due to swelling in arms or legs. So that would be related to someone who may have heart issues, stuff like that. So skin is important. If you see those signs, that could also mark that somebody needs hospice as well. Hard time breathing, so client is on oxygen and gets tired more quickly, or increased breathing rate with minimal activity. They're just walking from their chair to the commode or in the shower, or they can't stand up anymore. All those are signs of decline. Perhaps a client is already on oxygen and needing more oxygen to do whatever activity or even at rest. Those are all signs. The last point is weight loss. Overall eating less, looser fitting clothes, looser fitting briefs or diapers. So they have a shirt and it's hanging off their shoulder, or looser briefs that you have to tape it more, you have to roll it. They were in a large and now in a medium. Dentures not fitting anymore. So that's a good sign also that someone's lost significant weight, that their dentures aren't fitting anymore. Sunken facial features and ribs showing. So again, that sign that they have some nutritional decline and not eating as much or not metabolizing what they're taking in as much. And typical clients who are referred to hospice are those individuals with some diagnoses. Not all fall under this umbrella, but a lot of people do. So those individuals who have been diagnosed with Alzheimer's disease, a form of dementias, that there's other forms of dementia, not just Alzheimer's, but Alzheimer's disease, Parkinson's disease, heart failure, cancer, COPD, pulmonary diseases, chronic kidney disease, ALS, protein calorie malnutrition, and many other long-standing chronic diseases. So essentially, to wrap this objective up, is if you see somebody, hey, they were walking, talking, or engaging, or they were kind of at their baseline, and now few months down the road, they're, eating less, falling more, unsteady, stuff like that, they may need hospice. And so now you're thinking, okay, I see someone declining, or a client that you're thinking about may be appropriate for hospice. What do I do? So what you do is you can call into Bravo and you can talk to your supervisor about, hey, this is what I'm seeing, and I think they may need hospice, possibly. And so you don't have that conversation, particularly with the family, because Seasons Hospice, we are experts on having that discussion and supporting that family during that time, and saying, hey, they may need more support and may be appropriate for hospice services. So just let your supervisor know. It can be a difficult conversation, but let us, the experts, as well as your team at Bravo, know, and we can take it from there. So we can give them all the support that they need, whether it's our nurses, medical equipment, everything that they need to help with supporting them as well as their family at home. So I really thank you guys for listening to this video, and hopefully you got something out of it and can feel more comfortable with knowing what hospice is and what we can provide. Again, this is Monica Jackson with Seasons Hospice, Clinical Nurse Liaison.